morning everyone, how are you going? David Johnson here again. Just back up at the Sunshine Coast office today, so that means it's usually time for a quick little vlog and a bit of a chat about things. I get a bit lonely up here without the team around in our Brisbane office to talk to. I just saw a patient this morning about a brain condition, but she also said to me that she's been having a bit of a tough year with some neck pain and shoulder pain, as well as knee pain, and her treating team has suggested that she might need some shoulder surgery and possibly some knee surgery. And I said, what have you been doing about this these pains? And she says, oh look, I've been seeing fantastic people. They're all very caring and giving me lots of exercises to do, lots of strengthening work, stretching, manual therapy. And I said, have you seen a movement therapist by any chance? And of course she sort of looked at me a little bit strangely and said, what do you mean? Yeah, I'm doing lots of exercises. What do you mean by movement therapy? And I said to her, in a way that she could understand, all of the treatments that you're describing, the strengthening and stretching and manual therapy and gym-based exercises to try to strengthen your joints and your musculo-skeletal system, is a little bit like going to the mechanic for your motor car. What you're leaving out is going to the driving instructor. The driving instructor is like your movement therapy. So you can imagine what the roads would be like if we only had mechanics on around to help maintain the structure of cars, but we didn't have anyone teaching people how to drive those cars. So that seemed to make a little bit of sense to her, that you need both elements in terms of maintaining vehicle health, and the vehicle in this case is the most important vehicle of all, which is your body and specifically your musculo-skeletal system. You don't just maintain that musculo-skeletal system by going to mechanics to strengthen, stretch, mobilize, massage and adjust the musculo-skeletal system. You also must tie in there the driving instructor that teaches you how to move and coordinate that musculo-skeletal vehicle that is so important. And so when she understood that, she said, well, I definitely haven't had any movement therapy over the last 12 months. And I said, well, that may explain why you still have the pain symptoms in your neck and shoulder and your knees, and that may explain why you're now starting to consider having surgery to, you know, whatever it may be, stitch up some injured tissue in the shoulder joint, trim away meniscal tears in the knee, repair cruciate ligaments in the knee, things like that, breakdown of structural tissues that occurs as a response to biomechanical stress translating to biological inflammation transferring into pain and disability and structural breakdown. So if you want to reverse that unhealthy process, you must integrate a little bit of driving instruction, okay? Driving instruction being the movement therapist. All right, got to call in on the next patient now. Talk to you later.